Hi, we're Annie and Christian with Forest of Art and Healing Arts. In this video, we will show you how to do self-massage for the muscles and connective tissue of your head, face, and jaw. The session is useful for headaches, jaw pain and TMJ syndrome, hearing, balance, and vision problems. Right now, during the COVID-19 pandemic, this session is especially useful to work on problems caused by wearing face masks and other personal protective equipment on the head and face. Some governments have mandated the wearing of face masks in public. In Berlin, where we live, one is required to wear them on public transport and in stores and other indoor public areas. In some countries, one must wear them everywhere in public. And of course, hospital workers have to wear them as part of their job. While masks serve an important function with the containment strategies of the current pandemic response, there are some problems that can arise from wearing them. Face masks can cause the wearer to tighten the facial musculature, and they can distort the fascia of the face and neck and head. A tense musculature can lead to compression of the lymphatic vessels and lymph nodes of the face and neck, thus inhibiting the work of the immune system at the point where the virus enters. The compressive forces of the mask and its straps can also cause problems with the fascia. For example, the ground substance of the fascia can become less fluid and can harden. This makes it harder for the immune fighter cells to work in the face, nose, and throat tissue, and for the lymph collector vessels to drain pathogens, wastes, and toxins from the interstitial fluid.
Face masks tighten the face and head in a number of ways and for a number of reasons. I'm going to list some, they're not limited to these reasons. First of all, the pull of the straps on the face. Different masks are organized and strapped on in different ways and pull the face in different ways. For example, the more secure, tight-fitting masks, like the N95 masks that seal onto the face, they can pull the fascia of the face and compress it. We've all seen pictures of hospital workers coming off of a shift after having worn a mask the entire shift, and there are lines across the fascia of the face here, compressive lines. Notice in this picture how the straps can pull on the mask on the side of it and compress the side of the face. This can even affect the jaw muscles here and up here. Secondly, the clip around the nose can jam the nasal bones and it can compress muscles around the eye and around the nose. Now, on the question of jamming bones in the skull, we assume a craniosacral model, which holds that the sutures of the head are not fused and the bones do in fact have a bit of movement to them. Compressive forces can jam those bones. Number three, the masks that make a seal around the mouth and the nose, they pull the tissue tight and pinch it off. Number four, the proximity of fabric to the mouth. This can cause a retraction, a retractive contraction in the mouth. Many people who are wearing the homemade masks, the mask is just simply hanging across the mouth like that. On a psychological level, fear of contagion at the mouth and the nose, and also seeing other people masked up, can cause a retraction of the mouth and nose. This part here of the face, from the upper lip down to the jaw, is all hanging below the base of the skull and is susceptible to contraction and retraction. Point number six, the jaw is especially vulnerable to contraction in the face of danger. Here's how it works. This is because the jaw muscles are innervated by a cranial nerve called the trigeminal nerve. And the trigeminal nerve originates in a part of the brain where we sense danger, which is called the reticular activating system. So when we sense danger out in our environment, our brain at the RAS initiates a response, a danger response. And part of that response is to tighten our jaw. So if we're feeling like we're going to be contaminated at any moment or infected at any moment, and also if we're seeing mass all around us, the trigeminal nerve inevitably tightens up the jaw muscles. To prevent against this, one needs to perform a recuperative massage after one wears face masks. This is especially important for people who have to wear masks all day long or throughout their entire shift at work or in public. And since one might not have access to a bodyworker right now, we're going to show you how to do it yourselves. Now, the session can be done as a light relaxation procedure that you do after taking your mask off. So you wash your hands and then you wash your face, and then you do this light relaxation. The massage can be a part of your hygiene practice. The session can also be applied more deeply and slowly as a form of deep structural bodywork, and can make significant changes to your face and head. For example, the session is a great facelift. And the session can help to prevent the structural conditions that lead to headaches, jaw pain, dizziness, hearing, and vision problems. Now, a note of caution. If you have or if you use any appliances in your head, this session can make large changes to the structure of your head and face and jaw. So, for example, if you have dental implants, dentures, retainers, braces, hearing aids, glasses, contacts, or if you've had plastic surgery, a strong application of the work shown on this video can change the shape, position, and quality of the structures in your head, and it can affect how your appliances fit and how the scar tissue from your plastic surgery holds. So you'll need to consult your physician or dentist before doing any of this work. Also, this session can cause strong emotions to be released. It digs into the armored mask that one wears, and it can make changes to one's personality. The more one works through these tissues, the more likely one can reach this level of change. If you need help with this, see our video titled Self-Psychotherapy for Immune Support, or consult a therapist for help working through these issues. Here you can see the musculature of the human face. There are a lot of muscles, and they are necessary for the nuanced movements of the different parts of the face. Now, if we were to draw a mask over this, cover the holes, seal that mask on tight, strap around the ears, you can see then what muscles, what part of the face are being closed off, pinched off, and pulled by the mask. You can also see that other muscles, for example, over the ear or along the neck here, or the eye muscles, are also being challenged and being pulled on by the mask. A front view of the face shows us even more muscles and the lines of pull that they have. There are muscles across the bottom of the lips here that pull the mouth down or pucker the mouth here. There are muscles along the side here that pull the mouth back or pull the mouth up into a smile, and then across the top of the lips that pucker the mouth. You can see these muscles come up and connect into the eye muscles here. In this video, we don't need to name all these muscles. That's not the point of it, but just to see what it is we're working with here. And then there are muscles around the eyes. And you can see that along the nose even, there are muscles, and they come up and meet with the muscles here of the forehead. Looking now, if we take some of the bones of the side of the face off, we can see the jaw muscles here, the very powerful temporalis muscle here, which you see comes down and attaches to the jaw. Here it's been cut, but you can see the thick layers of the masseter muscle, one of the strongest muscles in the body. And then you can see along the side of the face, the buccinator muscle that makes that kind of fish face, and the various muscles underneath that connect the throat musculature here up into the head and then to the front of the chin. From this view here, we can see the nerves that innervate the face. We can see veins that drain the face, blood vessels that bring blood to supply to the face, and then this large parotid gland. Looking down at the neck, there's a very powerful muscle attaching here at the sternum and then traveling up behind the head and attaching to the back of the skull, right behind the ear. This is the ear right here. So this is a sternocleidomastoid, very powerful muscle. Muscles in the back of the neck, 5 layers of muscle along the back of the neck here. And then these muscles here along the throat. The mask is going to come down, and depending on what kind of mask you're wearing, is going to come down across here. And so it's going to put a strain on these muscles here. Here's a front view of the neck. You see that sternocleidomastoid. Now look at these muscles just on the front of the neck here, coming up, attaching to this floating bone here in the middle of the neck, and then that attaches underneath the jaw, and these muscles can all become very tight here. We're going to be putting our fingers up along here into these muscles. Something else to consider about what may be being compressed here is these yellow nodules here. These are lymph nodes. Look at how many there are. They're all over the face. And in between them, these yellow lines, those are lymph vessels. So the face and on the inside, for different lymph vessels and nodules of the throat, are going to drain this way down towards the heart. If these are compressed, you don't get good drainage from the face and the throat, which is a problem because that's where the virus comes in, attaches itself inside the mouth and the nose. And when the immune system fights against it, then the results of that, the waste of that, needs to be drained through these lymph vessels. In this image, you can see deep inside behind the jaw. So the jaw here has been cut, and you can see that behind the jaw there are these muscles here called the pterygoids. They're going to pull on the jaw, and then this muscle here. These are some of the main muscles that can become very tight when you wear a mask, because the string here, the loop around the ear, there's my ear right there, is compressing this area. Now to look inside the throat, one can see the muscles along the bottom here, and one can see that the tongue itself is an enormous muscle. All along here, the back of the throat, these are muscles. This is the trachea going down into the lungs. The nose right here, and this is the mouth. So the airborne particles with the virus can come up and attach themselves along here. This is where the swab test is done. And if they start to drop down into the lungs, then one is at risk of a serious illness. It's very important that this area here, the throat, nose, and mouth, remain very strong, and that you can fight that virus and keep it from going down into the lungs. This is sort of a funny view here, maybe. It's cut across the frontal plane, and what it aims to show is all of the holes in the bones. So here is the jaw down here, and the muscles across the bottom of the jaw. The tongue we showed is a very large muscle. And then the nose is here itself. It has cartilage pieces right there that increase the surface area and warm the air as it comes in. But you can see that all through here there are holes. These are called sinuses. These are obviously the eyes here and then the brain up in here. So these sinuses are all lined with mucus tissue, and they all have strong immune system that fights off anything that gets in there. Finally, looking at the skull itself, the bone structure, In craniosacral therapy, there's an understanding that these lines here in between the bones, these sutures, are not fused and that there should be a small amount of movement in them. And that if there's a lot of tension in the head, the sutures can be jammed or they can be inhibited from movement, and that's a problem. So that's a certain paradigm. Not all medical care practitioners subscribe to that paradigm, but we do as body workers. So one of the problems with mask wearing is that it can jam the nasal bone here. It can jam the maxilla into the zygoma here, that bone right there. And obviously it can jam. I mean, one can usually feel that it jams the jaw, the mandible. And finally, a look at the front of the face. Here's the two nasal bones. We'll be working on trying to release tension from around those. When we're talking about working along the bottom of the eye, that's there. We're going to be working across the top of the eye socket there. When we talk about working along the zygomatic arch, that's going to be along here. We're going to be working our fingers along there. And then also we'll be running our fingers along the bottom of the jaw, like that.
In this session, we are going to be working deeply on the fascia and the tissue around the eyes, nose, mouth, and jaw, and neck. If you wear contacts or glasses, you should probably watch this video all the way through to get an idea of what the strokes will look like and what you're going to need to do, and then watch it a second time through with either your contacts out or your glasses off, and simply follow along with my instructions as you do the work, because you cannot do this work with contacts in and you don't want your glasses on. Right, let's get started. So the first thing you want to do is you want to make sure you wash your hands and face thoroughly. In the time of COVID, we were told not to touch your face while out and about, so make sure that you wash your hands and wash your face. Once you do that, we're going to do some shoulder mobilization. So you're going to put your hands on your shoulders, and with your elbows, you're going to make big circles with your shoulders in one direction and then in the other direction. There's an intimate connection between shoulder tension and neck tension. So you want to make sure that your shoulders are open so that any release you do in your neck can be integrated into your body. Okay, so the first move we're going to do is we're going to stretch the fascia of a superficial layer of connective tissue connecting to a muscle called the platysma. What you're going to do is you're going to place your hand on the front of your chest here, just below the collarbone, the clavicle here. So I am just below the clavicle and I'm pressing down with my hand. So I'm pressing down towards my feet, and then I'm going to use my other hand to anchor. And then I'm going to rotate my head side to side. And then I'm going to dip my ear, side to side. You want to go very slowly because fascia requires time to stretch. Let's take that again. Side, ear descends towards your shoulder, and then towards the other side. And then come back to center. Okay, now you're going to take the pad of your thumb and you're going to place it in 3 locations along the underside of your clavicle. And you're going to start closest to your shoulder, and I'm using this part of my thumb to hook the fascia just below my collarbone, and I'm going to use this other hand to press that down. Now once I've got that hold, I'm going to mobilize my head. I'm going to rotate my head away, come back to center, and tilt my head over to the side. You can also bring those 2 movements together. So do a rotation and a head tilt. Then you're really going to stretch the fascia of the front of the neck. Now I'm going to do the second location, closer in towards the middle of my sternum, to the side. Rotate my chin towards my shoulder, and then I'm going to stack them together on a diagonal. Come back to center, and so I'm just below where the collarbone connects to the rib cage here. I'm pressing down with my thumb. Ear descends toward the side. Chin rotates towards the shoulder, and then I stack the two, tilting my head at a diagonal. Good, let that come up. Now we're going to do the other side. The pad of the thumb is going to connect to the tissue just below your collarbone on this side. So same thing. Turning my head away, tilting my ear towards the side, and then stacking the two. Second placement. Rotate my head to the side. Tilt my ear to the side. And then stack the two. Third placement. Just below my collarbone. Rotate my chin towards the side. Descend my ear towards the side. And then stack those two. Good, and come back to center. Now we are going to try to access the tissue, a slightly deeper connective tissue that connects around a muscle called the Sternocleidomastoid. It's a big muscle that runs up along this area here. So same thing, I'm going to contact at the same location, but do slightly different neck mobility exercises. So I'm pressing my hand in towards my chest a little bit, but mostly down towards my feet. Then I'm going to jet my jaw forward just a little bit, and I'm going to stretch my neck in a diagonal here. So I'm stretching along this muscle here. Come back up to center, stretching my jaw forward, and then come to the diagonal here. And you should feel a stretch along this muscle here. And breathe. Okay, so this next move, you are going to take your thumb and your index finger, and you're going to make a pinching, kind of like a clamp with your fingers. And you're going to find the borders of your SCM, Sternocleidomastoid. So this is your throat, your Adam's apple's here. You're going to be just to the side of it. So I'm going to grab a big chunk of this muscle between my thumb and my index finger. It's very intense. I'm simply going to hold. And if the tissue allows, I'm going to pull in a diagonal away from my throat. So there's a forward and an outward motion. So I'm going diagonally away from my throat. This may be very tight. If you aren't able to grab it off of the structure here, simply outline the muscle and try to press on the edge of that muscle border. Okay, so we've got another hold, same idea, pinching with the thumb and the index finger. If you feel a very strong pulse, back off of that and move to the side. And I'm going to stretch it slowly in a diagonal. Good. One more close to the jaw. This one's even harder to get, especially as I'm sitting up. if you can, grab it and pull it diagonally out to the side. If you are pressing on any circular nodule locations in here, just move to the side. You don't want to crush through your lymph nodes in here. So don't press hard on any circular feeling bulbous structures. Move to the side of them. All right? Now we're going to go to the other side. Same thing. Forefinger and thumb. Grabbing that sternocleidomastoid. If you can't grab it, just find the border and stretch it like that. So I'm not stretching towards my throat, I'm stretching it away from my throat. So I'm staying off of my throat here. In a diagonal, moving away. And breathe. Let's try second position here. Inhale and exhale and see if you can stretch that muscle in a diagonal in that direction. If this move tickles your throat and you start to cough, that's okay. That doesn't mean that you're necessarily getting sick. This work will loosen the structures in here. It will clean up some of the tension and maybe adhesions that are sticking structures together, and it will increase the immune function in this area. Let's go for a third location, up close to the jaws you can get. Again, if you feel a strong pulse, move to the side of that. Also, move to the side of any lymph nodes that you may feel. You don't want to crush them. And breathe deeply. Stretching as much as I can. I mean, simply grabbing the fascia of this muscle is stretch enough. But if you can get a little lift off of the structure, I'm stretching it in that direction. Good. And then come off of it slowly and just feel what you feel in the front of your throat. So now we're going to prep the fascia of the face for some deep fascial mobilization. First thing you're going to do is just simply place your hands on your the skin of your face, and you're going to press gently, but you're definitely going to give some pressure to your skin, and you're going to hook your skin and move it. So I'm just doing some superficial fascia mobilization of the face, getting the face ready for some deep fascial mobilization. So you're really moving that fascia around, especially around the nose. Around the jaw. Under the jaw. Okay. Next, you're going to apply a little bit of a moisturizing lotion or oil, whatever you normally use to moisturize your face. Right now I'm using a high quality coconut oil, and I'm just taking a very little bit and I'm going to heat it up in my hand so it goes from a solid state to a liquid state, and then I'm going to rub it into my skin so that I have a little bit of lubrication on my skin for the moves. So can apply it here to my face. You want to make sure that you have it around your nose and around your mouth and on your neck. Okay. So now what I'm going to do is, to get the right pressure of these moves, I'm doing it sitting down on a chair, and I'm going to rest my elbows on my knees here. So you want to find a comfortable seat so that you can make this position. And then I'm going to use the weight of my head coming forward onto my hands to add the pressure to the stroke. So for each of these strokes, I'm going to show you, I'm going to kind of paint the stroke on my face up here, and then I'm going to show you how I do this stroke in this position. So the first move, I'm going to use my finger pads and just the edges of my fingertips on my forehead, and I'm going to slide, I'm going to sink into the fascia of my forehead, and I'm going to slide slowly my fingertips across my forehead and then down onto the temples there. And it's going to look like this. So I'm keeping my neck elongated, and I'm simply resting my head on those fingertips. And I'm not pushing very hard or really pulling. I'm allowing the weight of gravity on my head to press into the stroke of my fingers, and the slight amount of glide with the coconut oil is getting some movement on this stroke. And once I turn the corner into the temples, sink a little bit, and then I come off. Now the next move, I'm going to use the pads of my thumbs, and I'm going to start at the bridge of my nose. I'm going to slide up, and I'm going to try to wipe my eyebrows off. I'm going to come around the edge of the orbits and sink all the way back towards my temples. So I'm on the bridge of my nose. I'm going to find where my nose bones, my nasal bones, connect to my forehead bone, the frontal bone, and I'm going to dig in there. A lot of tension gathers in there. And I'm slowly stretching the fascia up towards my forehead, along the ridge of my eye socket. And I'm gently sliding, so I'm moving the fascia of these structures out, up, and towards the side. So once I turn the corner of my orbit, I'm going to follow the structure of my orbit, and then I'm going to start to move this stretch lateral out towards the sides, staying on the fascia just underneath my eyebrows. I'm going to keep stretching it out to the sides, and then once the orbit curves, I'm going to sink down towards the sides, find the edge of the eye sockets here on the sides. You may find some tight fascia here. Sink and breathe, and then come off. With the thumbs in the same position, you're going to come back to where the nasal bone meets the frontal bone. There's going to be a little valley here. You're going to sink into that little valley, and you're going to scrape your nasal bones down, and if you can, out. So at a slight diagonal away. So if the masks compress the nasal bones in, we're going to stretch the fascia out and down of those nasal bones. So I'm starting right here at the corner where the nose meets the forehead, and I am with my thumb sinking into that crevice, and then I am stretching down those nasal bones. And out. Maybe I'll go a little bit closer in towards the eye sockets.
down towards the cheeks, and then stretch those nasal bones off of the face.
So with the same position and same thumb movement, pads of the thumbs, I'm going to start the same location at the bridge of my nose here. And with my thumbs, I'm going to stretch this fascia of the nasal bones down and out. And then I'm going to follow it and I'm going to stretch the fascia across the cheekbones. And I'm going to continue that out across that ridge, out towards the side of the head, along that bone ridge. So, starting at the bridge of the nose, stretching down towards my cheekbones. Once I get to the valley of the nose and the cheekbones, I turn a corner and I start to go out towards the sides with both of my thumbs. And I stretch the fascia along the ridge of the cheekbone, the zygoma. Now I'm going to continue this out towards the side. I'm on the ridge, so I'm not above it and I'm not below it. I'm right on the ridge of this bone. And I'm going to continue this till I reach my scalp. Good. Now the next one, I'm going to start at the same position with my thumbs. I'm going to come down the bridge of my nose. I'm going to find this valley where the cartilage of my nose meets my face bone here. And I'm going to then curve around the underside of my cheekbone. And right here, I'm going to start to stretch the fascia of my jaw muscle. And I got to slow down because it's going to be very intense. And I'm going to continue out into the jaw muscle and go right in front of the ear and stop. Okay, so I'm starting at the same place. I'm descending down towards my mouth a little bit until I get just below the cheekbone, and then I turn the corner with both of my thumbs and I start to go out towards the sides. I am cleaning off the underside of my cheekbones. This may feel very intense. Once you get into the jaw muscles, slow down and allow the tissue to soften under your fingers. It may take you several attempts over many different tries to get through some of the layers of tension in this muscle. And I'm continuing to go through this fascia of the jaw muscle. I'm going to keep going along this ridge here until I reach right in front of my ear. And then I come off. For this next move, I'm going to use my fingertips in a row like this. On either side, I'm going to find where the very base of the cartilage of my nose meets the top part of my mouth, called the maxilla. And I'm going to dig my fingers in here, and then I'm going to stretch the fascia down. So I'm just going to stop kind of basically at my upper lip. All right, so it's going to look like this. I'm allowing the weight of my head to sink my head into my fingers. I'm finding this ridge here, sinking my fingertips into this area. And then I'm going to slowly
stretch the fascia down towards my feet. Very slowly. Once you get to the teeth, you can lighten up and come off.
For this next move, you want to make sure that you've got a little bit more coconut oil or lotion. Make sure to put it on your lips because you're going to be stretching the muscles around your mouth very deeply and you don't want to split your lips. Okay? And then what I'm going to do with this is I'm using, again, the pads of my thumbs, and I'm going to stretch the fascia on the upper lip out towards the sides. I'm going to take it through the belly of the jaw muscles all the way out to the side of my jaw and then stop. And it's going to look like this. So the weight of my head is sinking into the thumb pads. And I'm slowly stretching the fascia of my top lip, top part of my mouth muscles. As I get to the ridge or the edge of my mouth, I'm going to slowly go through that because you're starting to get into the jaw muscles. And slowly allowing your thumbs to stretch that out towards the sides. The weight of my head is really encouraging the movement of the stroke. You may pop over the edge of some muscles. That's fine. Just slow down. See if you can control it a little bit to go back into the belly of that muscle. Until you get to the edge of your jaw and then come off. So the edge of my jaw, I'm trying to get as far back close to my ear as possible. The next move, same thumb pad contact, and I'm going to stretch the lower jaw fascia. So I'm stretching out to the sides, along the bottom edge of the jaw, out to the corners, and I will stop right where the jaw turns this corner here. Now, I can either keep my hands in a fist, or I can use my fingertips like this to also support my head. Whatever feels more comfortable for you. The pressure, though, you want it to be on your lower jaw. If you have an unstable jaw, press your tongue to the roof of your mouth as you do this move. Stabilize your jaw a little bit. So as you come out to the side, you're going to get into the jaw muscles on the lower part of the jaw. Also extremely tight. Slow down as you get into the thickness of your jaw muscle. Stretching through those muscle borders. Slow down if you come across anything that plunks you off of the edge of it. And as I come to the corner angle of my jaw, I'm going to try to take it as far back as possible towards my ear. For the next move, you're going to use your index finger and thumb like this to trace the edge or the angle of your jaw along the entire length of the bottom portion. You have lymph nodes on the underside of your jaw, So be careful if you feel any nodular nodes, just move aside. Don't crush through them. So it's going to look like this. So I'm sinking my thumbs up into this tissue here, just below, it's some of the bottom jaw muscles. Very, very thick muscles here. And once I get sunk into the tissue, I'm starting to spread that tissue back and out towards the sides. So I'm slowly spreading this tissue back and out towards the sides. On the underside of my jaw. So my thumbs are basically inside the ridge of my jaw. If you can see, I'm just opening up my hands here so you can see where my thumbs are. And the forefingers are helping to trace along the front part of my jaw. As I'm slowly stretching back and out towards the side. Careful not to crush through any lymph nodes. So if you feel any lymph nodes that are in the way under here, that are thick and bulbous, just gently move to the side of them. Don't crush through them. So as I come to the angle of my jaw, I'm rounding the corner slowly, carefully, and then I'm going to come off. So if you feel like any of the moves on the jaw may have compressed the jaw back, we are going to do a move to decompress the jaw. Now you're going to have your fingers in the row formation again, and you're going to start at the temples, and you're going to strip the fascia down along the length of the side of the jaw once you turn the angle, and you're going to come forward. So it's going to look like this. So I'm at the temples here. I'm sinking through the soft connective tissue to where it's hard. And that is where I am stripping the fascia. I am stretching the fascia. And now I'm into the jaw muscle fascia. I'm continuing to come down, so towards my feet. As I reach the angle of the jaw, I'm going to turn the corner a bit and just stretch that forward until I'm off the jaw muscle. So then the next one, we're going to stretch the ears. So you're going to use your middle finger and you're going to place it in one of the folds behind the ear canal. So you're not sticking your fingers in your ear canal. You're going to stick your fingers in one of the folds of your ear behind the ear canal, and you're going to use that position to do a stretch of the fascia of your ears. So I'm actually just doing the move right now. So I'm stretching up towards the sky, circling around towards the back, towards the ground, stretch forward. I may even come here and stretch that fascia forward, or I can grab the cartilage of the ear and stretch that fascia forward. I can also grab the earlobe and just stretch down. So we want to try to get the straps of that mask off of your ears. And then you can take your fingertips and do circles. So you're pressing into the fascia of your scalp behind your ears, pressing in and just making circles in the fascia here. So this next move, I'm going to traction the nose forward and down. So I'm going to anchor my index finger on my face, and then with the other fingers, I'm going to grab the fascia of the cartilage of the nose, and I'm going to stretch forward and down. So trying to decompress the nose down if the mask is jamming the nose up and in. So I'm anchoring my index fingers on my face, and with my other fingers, I'm stretching my nose forward and down. So this is how I'm stretching the fascia of my nose away from my face and decompressing it. Good. Now the last one, you're going to let your hair down, and with your fingers like this, you're going to keep your hands relatively firm, but you're going to move your forearm and your wrist in circles like this all the way around your scalp. So with the fingers like this, I'm going to contact the fascia of my scalp, and I'm going to make circles. So I'm trying to move the skin and the fascia of my scalp over the skull. You can see my fascia moving on my cranium. You may find some areas that are tighter than others, and just hang out there for a little bit longer and do mobilization, do circles. Your facial muscles begin in the scalp area. Make sure to get the back of your cranium here. Go up the center. Make sure you do around your ears. Okay, so that is deep fascial face massage.